I'm Ichiro Okano from Showa University, Tokyo, Japan. This is my disclosures. So degenerative disc changes are associated with a low back pain and negatively impact QOL. For the assessment of disc degeneration, so Farman grade is probably the most frequently used classification for lumbar disc degeneration on MRI. But the Farman grade is easily understandable and highly reproducible. However, the 5-grade classification may not be granular enough to detect the degeneration-related factors have a small or moderate effect. Recently, the Disc Signal Intensity Index, DSI-2, was introduced for quantitative assessment of disc degeneration with good result in identifying risk factors for progression of disc degeneration. So this is the definition of DSI-2. The signal intensity of the discs is divided by the intensity of CSF. It's a very simple one. As higher DSI-2 score is indicative for less degeneration. The values of DSI-2 demonstrated a linear association to the Farman grade, especially between grade 2 to 4. So the aim of this study was to investigate the potential risk factors for the progression of lumbar disc degeneration on longitudinal MRI data using DSI-2. So we retrospectively reviewed the data of patients who had multiple MRIs at least 3 years apart and looked at these factors along with the DSI-2. So the discs with highly collapsed disc were excluded for the measurement. So again, this is the definition of DSI-2. Discs between L1-2 and L5-S1 were assessed in 2 different time points. Here are the results. So this table showing the patient demographics, the median age was 60 and 53% were female. So this figure showing the association between DSI-2 and the Farman grade. DSI-2 had a linear association with the Farman grade. So this is the distribution of the Farman grade in 2 different time points, showing there are more grade 4 and 5 in later stage MRI. So this table showing the mean DSI-2 stratified by disc level in 2 different time points. Actually, there were almost no changes, but in 52 discs, mostly in Farman grade 5, DSI-2 was not measurable. So this table showing the result of merge variable linear mixed model regression analysis for the progression of disc degeneration. Change in DSI-2 demonstrate the age and the presence of congestive heart failure were associated risk factors for the progression of disc degeneration. Interestingly, presence of the diabetes had a seemingly positive protective effect on the progression of disc degeneration. And here's the discussion. We found that presence of CHF was identified as a unique independent risk factor for the progression of disc degeneration. There might be multiple reasons. The first is the blood supply. Previous studies showed impaired nutritional supply due to atherosclerosis was associated with disc degeneration. Another factor is physical activity. Decreased activity was also a risk factor for the disc degeneration. Also, CHF is associated with inflammation, which was considered a risk factor for the disc degeneration. And another finding of this study is seemingly positive effect of diabetes, which is counterintuitive. But studies regarding diabetes drugs demonstrated metformin and related drug have some protective effect on disc degeneration. That might be a reason. So this study has similar limitations. We have no information, no detailed information about some factors like medications, as I said. So also, unlike Farman grade, DSI-2 does not account for the disc height. This needs to be included somehow in future studies. So in conclusion, our result indicated that CHS was an independent risk factor for disc degeneration. Thank you for your attention.